start by introducing yourself.
Wait 1 second. Go ahead. Yeah.
Hi, I'm Dr. Sumita Ghosh. I'm from Ministry of Health, Government of India, and additional commissioner who is looking after the child health programs.
What has inspired you about the forum and this global community so far?
Yeah, way back when the first global forum meet was there, so India decided to consolidate its effort and focus on pneumonia, the major killer beyond the newborn period. 70% of mortality under 5 is because of pneumonia. So, we have run out several programs, though I took charge in 2020. So, this is one program which attracted, it was absolutely in a fledgling state, and I have worked towards it. So, I am very interested that this second global forum has taken place after this COVID period. This interests me because this is one focus program which targets pneumonia, the morbidity, mortality due to pneumonia from all aspects. So, I am very interested in that.
Wonderful. Why do we need child survival action now?
Yeah, child survival is a priority. So, very recently we had this call to action anniversary. Again going back years, India took it up seriously. Every child and every newborn act, INAP, it was taken up by India as India Newborn Action Plan. So, child survival in India, though it is progressing in a very right direction, the annual reduction is at around 6%, and we are well in track for achieving the SDG. But again the efforts and the activities should be veered towards it, because this is a vulnerable position, population which can change any moment. So, child survival is always at the top of the agenda.
What has India committed to doing differently to drive down child mortality?
Okay, there are several ways India has taken actions. The one is about having a general health system strengthening approach, in which all the level of cares like primary, secondary, tertiary, they have been upgraded, upscaled for improving child survival. But beyond that, there are focused programs which targets the major killers like pneumonia, like diarrhea, like preventive aspects like immunization, like malnutrition. So, India has under the RMNCHA strategy, it has taken a holistic continuum of care life cycle approach, so that child before it is born, the actions are taken for its well-being in the adolescent group, in the reproductive health women group, in the pregnant women group, and during ANC, intrapartum, postpartum, and beyond that for child survival. So, this strategy actually has ultimately resulted in the benefit of our children.
When you return home to India, what is one thing that will change as a result of the forum?
Yeah, so as I told you already the
Go ahead.
as I told you already, several measures in general health system strengthening and focused attentions are there, but there are a lot more to be done. One thing is that we have recently health and wellness centers where mid-level service providers have been inducted. They are called community health officers. So, they can play a very big role in primary prevention, promotion and early management of pneumonia. So, one thing we want to take is to them is capacity building of these mid-level providers. We have revise the IMNCI package, that is the integrated management of newborn and childhood illness. So, we want to work seriously towards it, so that all these 154,000 of CHOs, their capacity develops, and also our peripheral health workers, they are ready to provide the preventive, promotive as well as the early management aspects of pneumonia. So, this will go a big way, because 17% of mortality is still there for childhood pneumonia, and also other illnesses like malaria, like diarrhea, they can be well managed at the very early primary stage. So, I think that will show us the way. Every child born has a right to survive as well as thrive, for prevention of diseases, promotion of health and nutrition, as well as management of their any kind of illness. So, the health system strengthening is the way, because child are vulnerable, they are very delicate subjects, and additional capacity of the system is needed, additional capacity of the health workers are needed to give the proper care to them. And child cannot express, they cannot communicate their health needs. So, we have to walk the extra mile to reach them, to understand them, to provide them the necessary care. So, all our system, all our stakeholders must be ready to deliver it.